I'm Jenn Higgins, Vice President of Global Public Affairs for Guardant Health, which is a leading precision oncology company, for those of you who don't know. The American Cancer Society released an unfortunate milestone this year. More than 2 million people will be diagnosed with cancer in 2024. Of those cancers, lung cancer continues to be one of the deadliest cancers, with a bias towards impacting more women and even younger women at age 35 to 54 more than in recent years, including people who have never smoked before. I'm joined today by Shirley Munoz, a lung cancer survivor, and Eleanor Wheeler, the Director of Oncology for the Health Policy Partnership, to talk more about lung cancer and some of the important parts of the process that we can take on to help support patients and make a difference in this disease. Shirley, thanks for being with us. Can you tell us about your experience and your journey with lung cancer? I know it's such a powerful story, but I was stunned to hear when we talked initially some of the challenges that you face, but please tell the rest of the audience a little bit more about your journey.
Hi, my name is Shirley Munoz. I'm 37 years old, and I was diagnosed with stage 4 lung cancer when I was 34. I had symptoms for about 5 to 6 months, and initially all my symptoms were dismissed. The symptoms were a cough that wouldn't go away, back pain, shortness of breath, wheezing, and I was told that it was impossible for someone my age who didn't smoke to have lung cancer. So when I finally got the diagnosis, it was shocking for everyone, and even for healthcare professionals, it was quite shocking to see someone my age with my non-smoking history have advanced lung cancer. I've met a lot of other survivors. They've gone through the same things. You're usually told that if you were younger than 60 years old, there's no way that you could have lung cancer. So it took me a while to finally get an answer of what was going on with my body. And it took a few tries of me advocating for myself. I had to keep pushing the doctors to give me a diagnosis until they finally said, you know what? Yeah, it's lung cancer. We're sorry, but it's stage 4. Unfortunately, most people are diagnosed at stage 4 because of the issues that we have getting a diagnosis, especially at a young age.
Shirley, can I ask you a question? Which is, you seem like a pretty tough person. I'm guessing that you probably pushed through that symptoms for a while. Did you go to the doctor, or were you just like, I've got back pain and I gotta keep going every single day? What was that like for you in terms of going to the doctor and getting, feedback? I know you said it was 5 or 6 months of symptoms, but how many times did you sort of engage the healthcare system before you found out?
I probably had about 8 appointments. I even had a couple of imaging done, and I was told that there was no way that it could be cancer. I was told that it could be pneumonia, tuberculosis, but cancer was like less than a 1% possibility for me. So I did go to the doctor. I saw a few specialists, and yeah, at the end, I ended up with this diagnosis.
Wow. No, that's I think it's I mean, you're so young, but I'm sure this is not, unfortunately, like an uncommon story anymore, right? That people are sort of dismissed in the healthcare setting, but 2, also facing the challenge of trying to figure out like what's actually wrong with them, right? And if it was pneumonia, hopefully you'd feel better at some point, but it sounds like it just continued to persist. I'd love to turn to Eleanor for a minute. Maybe, Eleanor, could you tell us a bit about sort of your work and experience in the space of lung cancer?
Yeah, absolutely. Thanks for having me, Jen. So I'm Eleanor Wheeler. I work at the Health Policy Partnership, which is a UK-based health policy research consultancy. And as part of my role there, I have the kind of strategic oversight of our portfolio of oncology projects. And one of those, particularly related to lung cancer, is that I lead the team providing the secretariat to the Lung Cancer Policy Network. And that network is a global multi-stakeholder alliance that is really dedicated to making lung cancer policy priority.
How long has that been in existence, the lung cancer policy?
So the network was set up in 2021. It was
wow.
So it's been a kind of 3 years. It was initially set up as a project of the Lung Ambition Alliance, and it's a multi-funder network. It's really got a range of stakeholders involved, including industry partners, clinicians, academics, patient advocates, patient organizations, and it has membership from really all around the world. I think sort of 26 different countries are now represented in the network. So from, just a few years ago, it's really grown in terms of its kind of scope and hopefully, ability to impact in terms of raising up the profile of lung cancer.
Well, hey, we're lucky to have you here and have such fantastic expertise. So you've heard a bit of Shirley's story, a powerful one for sure. And as you know, we're sort of seeing rising rates of lung cancer globally, including women and non-smokers. Who's at risk? Obviously, this is no longer a smoker's disease as maybe it was 20 or 30 years ago. Can you educate us a bit on some of the statistics, risk factors, sort of global trends in the lung cancer community?
Yeah, absolutely. So I guess, there's so many statistics that we could talk about. I think, to kind of think about that broader picture or the broader context around lung cancer, at the moment we're seeing rising rates of lung cancer on a global scale. We're seeing that lung cancer is the most commonly occurring cancer worldwide. It's then followed by breast and colorectal. But alongside this, lung cancer is also the leading cause of cancer-related deaths. And actually, almost 20% of all cancer deaths globally are from lung cancer. So it has this absolutely huge impact. I think something that's also really important as part of this conversation is looking at one of the reasons for that really high mortality rate. And it's because, exactly as Shirley was saying, it's often detected at a late stage. And the later stage, lung cancer is harder to treat than early stage. So I think that just really emphasizes the huge importance of improving early detection of lung cancer.
Do you think the average person is aware of some of frankly, the trend lines in lung cancer? I think because of that stigma around smoking, I think it's probably very hard at times for people to even know that lung cancer is something that could impact them. Is that something that you've seen globally, in the sense that there's a lack of education about the impact of lung cancer, or particularly getting diagnosed at a late stage, and the lack of early detection?
I think so. And I think, there's probably multiple factors around that. And, one of them, I think a lot of the symptoms for lung cancer are really similar to other kind of health conditions. COVID had a massive impact. People had COVID-like symptoms, but they were lung cancer. It's often hard to kind of know maybe that combination of symptoms in terms of persistent cough. And, Shirley, you were talking about backache. Those maybe aren't things that people necessarily immediately associate with lung cancer. But I think also there's, as you were saying, maybe not awareness around the multiple different risk factors that there are for lung cancer. And I think there's really common understanding that smoking increases risk for lung cancer. But actually, we see that there is actually many other risk factors. So the second leading cause of lung cancer is air pollution. And lung cancer deaths associated with air pollution have actually risen by 30% since 2007. There's also things like genetics. Genetic risk factors account for a pretty significant proportion of cancers. And, we're seeing research that shows that there's a higher prevalence of lung cancer in certain regions, such as Asia and Latin America, that look like they're linked with these kind of genetic factors. And then there's also things like secondhand smoke exposure, radon, asbestos, this whole host of risk factors that are linked to lung cancer.
Wow, it's incredibly disconcerting to think that there are so many different factors involved on whether you can get a cancer. And that probably contributes to why lung cancer is the leading cause of cancer death in the world, unfortunately. Shirley, I'd love to hear from you for a second. We talk a lot about in my world at Guardant about where people get care, right? And so in the oncology setting, there are a lot of people that gain advantages by being sort of closer to large academic medical centers, but the vast majority of cancer care is provided in the community setting. Can you tell us a little bit about where you got your care in terms of I think you're in Southern California. Tell us a little bit about sort of that access point in terms of getting care, and how you got to the oncologist that you ultimately worked with.
Well, when I started having symptoms, it was during the COVID pandemic. So it was a little difficult to have access to a specialist. And I believe that was one of the reasons why my diagnosis was delayed. And Yeah, at that time I was underinsured, which is another factor that contributed to me being diagnosed at a late stage with cancer.
Did you have a tissue biopsy? Were you able to get in and get a tissue
I
biopsy during the pandemic?
I had a tissue biopsy, yeah, and that's how they eventually diagnosed me with stage 4 lung cancer.
That's one of the things that we talked about a lot in terms of, tissue versus blood, right? Which is especially during the pandemic, how hard it was for people to be able to get in easily to get tissue biopsies. And one of the advantages that we saw with Guardant, and at least with liquid biopsy, was that many oncologists were actually sending phlebotomists to people's homes to get a blood draw because they couldn't come in to get a tissue biopsy. So I'm glad to hear that you were able to get in and get one, but I can imagine that was a scary situation too, to have to go into a healthcare facility during a global pandemic.
Oh yeah, it was very scary. And unfortunately, after the tissue biopsy, we only found out that it was lung cancer, but we couldn't find any targetable mutations. And my oncologist told me that lung cancer was no longer an immediate death sentence like a few years ago. So she told me, if you have a targetable mutation, you can be on a pill, and you're gonna live for many years, and you're gonna continue living a fulfilling life. So I was really looking forward to that, but no mutation was found through a tissue biopsy, and then eventually through a blood biopsy, my biomarker or mutation was found, and I was able to be switched to targeted therapy. And with targeted therapy, I live a pretty normal life.
Wow. How did you find out about it, though? I mean, you were progressing, and so the doctor decided to pivot to a liquid or blood option. Did you do any research or sort of have to advocate for yourself to get another test at that point in your care journey because you wanted to be on a pill every day?
I had joined some patient support groups, and I started seeing that a lot of lung cancer patients were on targeted therapy. And I was like, well, why can that be me? If I'm young, I don't have any risk factors like smoking. So when we saw signs of progression, right away we got a blood biopsy, and that's how we found out that I was ALK positive. So now I take 8 pills a day. I do have side effects, but it allows me to still work full time, travel, and basically still live a very fulfilling life, even with a stage 4 diagnosis.
How did the support groups help you? I mean, so many patients that we work with have the opportunity to sort of to connect with patient advocacy organizations and patient groups. Did you find one in your community? Did you find one online? Like, where did you go to get that information to better understand that you could want to be on targeted therapy?
Yeah, I started looking on Instagram and Facebook. I'm very active on social media. So that's where I was getting all my information. At the beginning, after I had my tissue biopsy, I didn't even know that a blood biopsy existed. So then I started seeing posts about a blood biopsy, and I asked about it, and I was told that it was not necessary because I had already had a tissue biopsy. But then with the progression, that was an option, and at that point, I had already switched to another cancer center. And the first thing my oncologist did was order a blood biopsy.
It matters where it's hard to say that we figured out over time that coverage matters. Like you said, you were underinsured, but having the right insurance matters. For some people, it also matters where you go, right? And so we're definitely trying to change that. I know some of the work that Eleanor is doing is really helping to kind of remove some of those barriers for sure. Eleanor, we hear some of these challenges all the time about reimbursement and sort of broader costs. Like, how can some of this sort of we'll call it kind of the infrastructure of healthcare, but like the networks, the resource groups, the advocacy organizations, industry play a bigger role in helping to break down some of these barriers because we want everyone to have access to the same type of care that Shirley got and not have it to be something that's protracted. She shouldn't have had to fight to get it.
Yeah, I think there's maybe a few different kind of things to think about here. And I think, one of the things is about making information just more accessible. So, Shirley is talking about finding this information not via support groups. Not everybody knows that those are there. Not everybody maybe is on social media and can kind of tap into that kind of information. So trying to make sure that level of information is accessible to everybody. And, that also the healthcare providers, policymakers as well, have maybe a better understanding of lung cancer and what kind of best practice care looks like as well. I think also, again, we touched on this a little bit earlier, but something that I think we should talk about more is that the statistics that, we kind of reference at the beginning in terms of incidence and mortality, and particularly that mortality statistic, doesn't have to look like that. And if governments and policymakers, had this understanding of the potential that improving earlier detection could have for lung cancer, whether that's via screening or kind of by other mechanisms, as well as looking at how they could improve care for people with lung cancer, I think we'd see, a really significant change. But to do that, lung cancer needs to be on the political agenda. And I think that's something that has been difficult. It's not as easy as it sounds maybe to say, like, let's make this a policy priority. And that's really why, the network was set up and functions as it does, and collaborates with so many of these groups, both within countries. There are a kind of organizations that are part of the network that do amazing work, whether that's in terms of patient advocacy, policy engagement, research, working directly with patients in their countries, and pulling those together to create this global group, I think enables us to kind of pull together this shared knowledge, and to then take that and package it up in a way that is accessible and is clear and can be understood both by advocates and also the policymakers that, we're trying to engage with as well.
It sounds like there's not one of the questions I was going to ask, but you just answered it, which is there a way to establish this sort of centralized resource or like single source of truth? And it sounds like with the stakeholders that you've pulled together, you're trying to do just that on a global scale, whether that be on the policy side, but also on the sort of education and awareness side about all the different facets of early detection. I find that really interesting. I'm curious to know, in your experience, do you think the U.S. is a leader in sort of early detection in lung cancer, or are we sort of behind the rest of the world? I mean, are there countries that stand out to you that are excelling in the space of improving care for lung cancer patients?
Yeah, I think it's really interesting, and I think it kind of differs depending on where you look at terms of improving care. So I think one thing that is really stand out about the US is that the US implemented targeted low-dose CT screening for lung cancer, more than a decade ago. So that in itself is, a huge opportunity to at least be screening for people who are high risk of lung cancer and enabling that early detection. And we've seen some, fantastic actually research that's, I think, came out just at the end of last year that showed that through that early detection of lung cancer in screening, people's long-term survival was, way up there, more than 80-90%. And that was at 20-year follow-up. So, completely different outlook that is amazing to see. I think maybe, some of the areas that there's room for improvement. Shirley, you were talking about some of the difficulties around insurance and reimbursement, and that picture looks really different across the globe. There are some health systems that are set up where that isn't an issue, but, screening isn't in place. And so I think there's just so much complexity in terms of what is accessible for people and when and how and where. That's, again, one of the things that the network is trying to do, to kind of say, this is what's working in this location. What can we take from what's working well in one country? How can we apply that to the health system that we're working within? And so I think there's really interesting kind of learnings that, the US might want to take from countries like New Zealand, Australia, who are more in that kind of research and rollout of a screening program, but looking a lot at how to ensure that kind of traditionally underserved communities are actually really engaged and are offered and involved in developing that screening so that it actually works for them, and they are going to be attending, and that the uptake is going to be realized to really see the benefits. I think that's one really nice example, actually.
I think that the low-dose CT, I mean, the advancements in technology to be able to drive, better screening and lung cancer, that's improved so much even in the past decade. And companies are now developing screening tests for lung cancer to help navigate people to low-dose CT. And we hope that maybe in the future, you have a liquid biopsy or a blood-based option that allows for patients to say, I got screened for lung cancer, now I need to go get a low-dose CT to confirm that diagnosis, and then hopefully get treated the right way. And I think it sounds to me like there are countries that are doing it better, but low dose CT is still not something that's in every community and every hospital in the world. Right? So there's work to be done, even increase access there, which is where hopefully a blood test comes into play. But we clearly have a lot of great technological advancements there too. Shirley, back to you for a second, which is, thanks for sharing your story. I think at the end of the day, like there are so many patients now that I think are a lot like you in the sense that they're highly empowered. They're not satisfied just to get told, hey, your back hurts, move on. Like you're going to keep fighting to push ahead. And you did a fantastic job of advocating yourself. I think, what's one thing that you wish people knew, or what surprised you about this process that you're like, hey, if I were 35 and going back, or 34 going back through the process again, is there something that you wish people knew that you'd want them to know about how to either advocate for themselves or just even about your journey that's worth sharing?
Yes, I wish I had known at the time that it is possible to get lung cancer at 34, even if you don't smoke. And there's a phrase that all lung cancer patients say, which is anyone with lungs can get lung cancer. And I wish I had known that. And I am working to make sure that people know that anyone with lungs can get lung cancer. And I've noticed that in the Spanish-speaking community, there's a lack of information about lung cancer. There's a lot of stigma around it, and I've been doing advocacy work in Spanish to try to educate the Spanish-speaking community in the U.S. about the risk factors and about the fact that lung cancer can happen to anyone.
Absolutely. No, I think that it's so powerful to not only advocate for yourself, but I think in the ability that you have now as a survivor to give back to communities and to be able to support others on that journey is so important. And so thank you so much for the work that you're doing. Eleanor, I'm interested to know kind of, you talked about sort of the landscape of, early detection, the work that the policy network is doing to try to drive this. But, there's clear to me that there's more we can be doing in science and industry and government to support patients. I guess, can you think of sort of what is the one thing we need to be doing maybe as a society to make this journey less challenging for people like Shirley and others who are just trying to navigate the healthcare system and get better healthcare, right? I mean, there has to be something that we can be doing as a collective to really drive that conversation forward.
Yeah, I think to boil it down to one thing that's pretty difficult. But I think it is that piece around education. That's kind of the key, is providing information. And I think, what we want to see is that by sharing this information about risk factors and, kind of addressing these misconceptions and misunderstandings and misinformation about lung cancer, that everybody gets a better understanding. And so, from that kind of patient perspective, or even, people who are just at risk potentially, understand more about what some of those kind of risks are, and policymakers understand the huge benefits that they could see by actually prioritizing lung cancer and looking at, how can we make care better and especially faster, looking at, whether that's through screening to detect people who, don't have any symptoms of lung cancer, to looking at what does the kind of care pathway for lung cancer look like for those people who do have symptoms, so that it isn't, week after week after week, going back time and time again to your healthcare provider. But, looking at some of those things like rapid referral pathways and, utilizing some of the new technologies that we're seeing coming out as well, that can even build into other, programs looking at TB screening, for example, to really just do more to speed up that kind of detection and diagnosis and get more people's lung cancer detected at that early stage when we see the best outcomes.
I think we've touched on this, but we talked a little bit about policies that sort of need to be enacted to increase the survival rate of lung cancer. And it sounds to me, from what I'm hearing, the network has done a great job of sort of compiling not only best practices, but also, looking for continued ways to sort of bring those best practices into other countries. Is there anything else that you can think of from the policy standpoint that we're missing, that we haven't talked about, that's worth raising in the context of, what either individuals or different governments can be doing to drive the effort forward?
I think one of the things that we have seen really clearly as a network, as we've, talked and shared what's going on across the globe, is that we really need to see more countries develop national cancer control plans. There's some countries that don't have national cancer control plans, and specifically that national cancer control plans should include lung cancer, and also that countries should develop and put into practice early detection strategies for lung cancer. And I think, again, it's really easy to say that, and it's a complex thing to develop and deliver. And part of what the Lung Cancer Policy Network is, again, trying to do with some of the resources that we're putting out there is to illustrate, some of the different early detection strategies that a country might want to build into its own kind of plan. We've also looked at what care pathways look like, how they could be optimized. So some locations do have care pathways for lung cancer. Again, a lot of places don't have care pathways for lung cancer. And so I think the kind of policy angle here, there's this huge opportunity to promote more equitable access to diagnostics, to care, and even to ensure monitoring actually as well, through national registries, and better understand who is being affected by lung cancer.
Well, I also would imagine that funding's a factor too, right? Funding for research, funding for early detection, funding for access to other services and those care pathways, because the reality is, even in the US, funding is not where it should be. And I do think a big part of that is still largely attributable to stigma, unfortunately, right? Which is, could be better in many of these places, but we're going to prioritize funding X cancer or Y cancer. And one of the things we've always talked about in the work that we do is really that cancers aren't competing with each other. Cancer is a universal problem and a universal challenge for millions of people throughout the world. We can't say because you have this cancer or this cancer, you should be treated differently. And that's where I think, to your point about equitable access, funding is also a huge part of that, and policy development has to really focus on. We're looking at mortality reduction, but we're also evaluating the fact that cancer is a leading cause of death for millions of people, regardless of the type of cancer and when you get it or how you get it or where it came from. So I think that it's a great talking point to make sure we understand that and we can apply that. But the funding is also a huge piece of the process, and hopefully more companies and organizations can continue to drive investment in research and technology. I definitely recognize that there's so much more to be done. I think this has been a really fantastic conversation. So I really appreciate both of you taking the time. I know the audience has gathered some great takeaways from this discussion, as have I. So I appreciate your time, and thanks again for joining us.